Today we're going to be doing the coracobrachialis. It originates at the apex of the coracoid process of the scapula and inserts at the medial surface of the middle of the shaft of the humerus, which is opposite the deltoid tuberosity. So basically our coracobrachialis, it flexes and adducts the shoulder joint. So today what we're going to be doing is I'll have you have your elbow flexed, full flexion. You're going to try to bring it down into your side, and I'm going to kind of resist that. But first we're going to test if you can do that motion without any resistance. It's going to go gravity, full range of motion, all the way back up. Perfect. Now I'm going to add some resistance towards your elbow. We're going to see if you can kind of resist that as well. So go ahead, resist. All right, relax. And we're going to do a little bit more resistance. Wonderful. Today we're going to be doing the triceps brachii as well as the anconeus. There's three heads for the triceps brachii, which makes sense. Tri, meaning three. The long head originates in the infraglenoid tubercle of the scapula. The lateral head is lateral and posterior surfaces of the proximal one half of the body of the humerus and lateral intermuscular septum. And then the medial head originates at the distal 2/3 of the medial and posterior surfaces of the humerus below the radial groove and from the medial intermuscular septum. All of these have a common insertion at the posterior surface of the olecranon process of the ulna and antebrachial fascia. The anconeus originates at the lateral epicondyle of the humerus and posterior surface. It inserts at the lateral side of the olecranon process and upper 1/4 of the posterior surface of the body of the ulna. It's important to note that these muscles work together to perform elbow extension at the elbow joint. They offer stabilization for the shoulder as well as the ulna during pronation and supination for the anconeus. The differentiation here is that the long head of the triceps assists in adduction as well as extension of the shoulder joint. So to do the manual muscle testing, we'll first test against gravity. It's important to note you don't want to lock out. We want to find a good balance to where those muscles are engaged and not actually locking out the joint. So you'll have your patient prone, lying on the table with their elbow adducted 90 degrees in a neutral position. Is it okay if we do this muscle test? All right. So you'll support the elbow close to the elbow under the biceps. They'll drop their arm, let gravity hang. So go ahead and drop your arm. And then I'll have you go up, extend that elbow, and not lock out completely. So you'll feel these muscles engaged here, but if they were to lock out, then the joint is locked out and it's not necessarily the muscle. So go ahead and drop. Now we're gonna resist a little bit and I'll have you try to extend. Perfect, drop that. So that'll be a 4 about there. And then I'm gonna apply harder pressure, go ahead. Wonderful, relax. And that'll be that 5 there. We're in the deltoids now. So the deltoid has 3 different fiber directions. We have our origin of the anterior fibers at the anterior border, superior surface, and lateral 1/3 of the clavicle. The origin of the middle fibers is at the lateral margin and superior surface of the acromion, and posterior fibers are the inferior lip of the posterior border of the spine of the scapula. These all insert at the deltoid tuberosity of the humerus. So your deltoids are responsible for shoulder abduction and adduction. It can assist in flexion and extension of the shoulder as well. So to kind of test that, I'll have you with your elbow flexed at 90 and your shoulder at 90 degrees as well. We'll kind of go through that full range of motion. So I'll have you go down to your side and all the way up as high as you can go. Perfect. Now I'll have you go back to that middle spot there. Is it all right if I put some hands on you and I'll have you kind of resist going up? Perfect. Now go ahead, reset, go back to that middle. I'm gonna add a little bit more pressure to you. Wonderful. So that would be that 4 and that 5. So continuing on with deltoid, we're gonna do a posterior deltoid test, which includes the patient sitting in erect position. I'll have you go ahead, lift your arm for me. So we want the shoulder abducted, with a slight humerus medial rotation and slight elbow extension. You're going to stabilize the scapula and have your patient push against your arm. Go ahead, push. Perfect. Relax. You're going to do that again with more resistance. Wonderful, relax. All right, we're gonna be doing the pectoralis major, and we're gonna be doing the upper portion in this first video. So the upper fibers, which is the clavicular portion, originates on the anterior surface of the sternal 1/2 of the clavicle. It then inserts on the crest of the greater tubercle of the humerus, and these fibers are more anterior and caudal on the crest than the lower fibers. The action of the upper fibers is to flex and medially rotate the shoulder joint and horizontally adduct the humerus toward the opposite shoulder. So to do this test, we are going to have our patient lying supine on the table. They're going to then raise their arm in shoulder flexion. So go ahead, raise your arm, and then you're going to stabilize the opposite shoulder, and then just right about the elbow joint, you're going to go in a abducted resistance, and they're going to kind of try to force back medially or in adduction position. So with their humerus slightly medially rotated and their shoulder fixed, they're going to do that. But first, go ahead with your arm flexed, kind of move more medial, perfect. Now we're going to resist. Is it all right if I do some hands-on? All right, go ahead, resist. All right, relax. Then you're gonna go do some more pressure. Go ahead and relax. Now we're going to be doing the pectoralis major lower portion, which is the sternocostal end. The origination of these lower fibers are the anterior surface of the sternum, cartilages of first 6 or 7 ribs, and aponeurosis of the external oblique. The insertion of the lower fibers is the crest of the greater tubercle of the humerus, and these fibers twist on themselves and are more posterior and cranial than the upper fibers. The action of the lower fibers is to depress the shoulder girdle by virtue of the attachment of the humerus and obliquely adduct the humerus toward the opposite iliac crest. To conduct this test, we will have our patient lying supine again with their arm flexed at 90 degrees, perfect. So they're gonna be going for that opposite iliac crest on this movement. So go ahead, find that range of motion there. Awesome. And then with your legs flat for me. It's all right if I add some pressure, some hands on. You're gonna resist and fixate that opposite iliac crest on the hip end to prevent any rotation there or any compensation. So with that resistance, you're also going to pull in an abducted position, and they're gonna try to reach for that opposite iliac crest. So go ahead. Awesome, relax. Then you're gonna add more pressure as well. Go ahead. Awesome. All right, we're gonna be doing the infraspinatus. It originates on the medial 2/3 of the infraspinous fossa of the scapula, then inserts at the middle facet of the greater tubercle of the humerus and shoulder joint capsule. The action of the infraspinatus is to laterally rotate the shoulder joint and then assist in stabilization of the humerus and the glenoid cavity during movements such as lateral rotation. So we're gonna have the patient lying in prone. They're going to have their arm out. You're gonna fixate under the arm here to prevent any abduction or adduction. A simple way to do that is you can rest your femur against their arm to kind of stabilize that elbow. You can fix the scapula and then laterally and medially rotate. So we're gonna have you here. Go ahead, rest against that and stabilize, and then go ahead, push against my arm here. Go ahead, relax. Do one without gravity, just to show that movement. Perfect. And then go ahead, push against with more pressure. And relax. Finally, we have the teres minor. It originates in the upper 2/3 dorsal surfaces of the lateral border of the scapula. It then inserts at the lowest facet of the greater tubercle of the humerus and shoulder joint capsule. The action of the teres minor is to laterally rotate the shoulder joint as well as stabilization of the humerus in the glenoid cavity during any movements of this joint, including lateral rotation. So we're having the patient lying supine. You're going to fixate this joint with pressure at the elbow, at the distal end of the humerus, so there is for sure rotation happening. Do you mind if I do hands-on? All right, so go ahead, Do your lateral and internal rotation. Perfect. All right, so then to test this, you're going to provide pressure against the lateral rotation. So you're going to push medially and they're going to rotate laterally. Mind if I do hands on? All right, go ahead. Awesome, relax. And you're going to apply more pressure. Go ahead and relax.